We're back.
We're back after a long night.
It was a long night. It was a great night.
It was a good night.
It was a
Yeah,
good
we had
night.
our annual company party last night.
Yeah.
Like our big one, like the everybody
And
goes
their
type thing.
spouses.
Everybody and their spouses
Yeah.
party. And it was also like a 25-year anniversary thing.
Yeah.
Right? Yeah.
Yeah.
So even more special than usual.
How do you feel going into stuff like that? Like, do you have a plan going in?
I like not as good of a plan as you have said in the past that you have, like as far as arrival time and leaving time.
I had no plan for that last night.
Yeah.
But I meant
Because
like,
you knew you were going to break it.
well, I know. I mean, like, are you going to be like, I don't know. Are you going to be serious?
Rowdy?
Yes.
Anyway,
You're going to be carefree. You're going to be rowdy.
no,
a little spicy.
yeah, I pretty much wanted to be a little rowdy.
Okay.
Yeah.
Did you
I
accomplish
accomplished
that?
it, I think.
Okay,
Yeah,
good.
I think so.
Okay,
I
good.
think we got the dance floor started. I
Yeah,
would attribute that to us.
There was some egging on to have that happen. Not that
Yeah.
I didn't expect that, but I felt very good about it.
Yeah.
Yeah. I didn't talk work at, well, listen, like 7% of me maybe talked work.
Talking about like, I mean, yeah, we did talk work a little bit. So
But like a little bit.
I started my night talking work.
Okay, but like it didn't last long, and
It didn't
wasn't
last long.
Yeah, and that's one of my husband's like pet peeves is that if it goes into that, he's like, I don't. But he said last night at the party, the place we had it for the past 3 years, this was the best one.
Really?
He had the best time.
That's awesome.
I asked him for a highlight, and he was like, I didn't really have a highlight. It's just that the night went on, and I wasn't like,
Well, get me out of here.
yes,
Yeah.
yeah.
Good.
Yeah.
Yeah. No, I thought
that
it
was-
was a really good one. Like,
Yeah.
it was the appropriate amount of rowdiness in my
Yeah.
mind, the appropriate number of tequila sodas, which I think sits around 5 or 6. Or something.
I ordered some,
Yeah.
and every time I got distracted, I put my drink down and could not find it again. It happened with my dinner plate. Like I got dinner, put it down, got up, did something, whatever. I came back, my plate was gone. And that's like how it happened for
Just,
the
like,
whole night.
cleaning up after you
Yeah.
as you go.
Yeah, so I remember ordering a drink. I gave it to somebody else. I ordered a drink. I put it down. Ordered a drink, and I was dancing with it. I was like, this is stupid. I put it down. Never saw it again.
Yeah.
So I did consume some drinks.
Yeah. We don't know the number.
We don't know the number.
We have no idea.
We have no idea.
I also think, and this is why I'm a tequila soda fan, like it's hydrating. I never wake up feeling bad
So-
after I drink tequila soda. Never say never.
Never
but
say never. Yeah. No, I don't feel bad today. I feel like I didn't want to lift legs this morning, but I will probably after this. So
Yeah.
overall, very good.
I did it
Yeah.
right before last night because I was like,
Yeah.
probably won't want to
smart.
do it tomorrow. So
Smart. So that was the end of our week. So let's go backwards.
yeah,
Let's go.
reverse.
This is just going to
Rewind.
be walk a week in our shoes.
Walk a week in our
It's a
shoes,
weird
round
one.
2.
Yeah, this was a weird one this week.
Yeah. It was an interesting week. It was like volume wise, very, very low and
Yeah.
not stressful in that aspect for me. And then for whatever reason, or I know what reason, it was like a very difficult week and stressful. Like I left and started every day with like my heart rate super elevated. I had like palpitations all week. Like
That's not good.
I know.
Yeah.
Yeah. Like I would go home feeling like jittery and like anxious and on edge. And then like I don't sleep good because of it. Like I woke up on Thursday or maybe it was Wednesday night at 3:00 in the morning.
Yeah.
And I was like, I can't, like I'm jittery.
Yeah.
And I had to like do something with
Yeah. What did you do?
I picked up my laptop and I started
Just
working on
started
stuff.
working, yeah.
So
Well, that's good. I mean, at least your brain like has somewhere to put that as opposed to just sitting there staring at the ceiling.
I know.
It's never good.
I tried to. You should like try to fall back asleep.
Yeah.
You know, and then when you can't after a while,
Yeah.
I just call it. So,
But-
that overall, rough week.
Rough week. Okay.
Yeah.
Well, my week, first of all, we had a snowstorm here in North Carolina, which is not
Yes.
snow. It's just ice. And to be clear, super icy. Super icy.
Yes.
I had Monday off. Like I wasn't planning on coming in Monday. Didn't have any patients scheduled, whatever. I was supposed to take my daughter on a college tour, but I ended up canceling that because I don't want to sit in the traffic of whatever people can't do in North Carolina when it snows. So Sunday night, or maybe it was Monday morning, we knew the hours of clinic were going to be short. So I came in.
Yeah. Yeah.
But I didn't like, I wasn't supposed to. I didn't
Yeah.
but I thought, I don't know, like whenever it snows, rain, sleets, whatever,
Yeah. Not technically real snow.
I feel like I have to demonstrate that this is okay for me, therefore other people will think it's okay. Like, I don't want you driving in and then you're calling me and I'm like, oh, hey, hold on, let me put my show on pause. You know what I mean?
It makes you feel like, you got to go down with the ship kind of mentality.
So I thought I would lead by example. And turns out there's not a lot of people in the office to show an example to, because it was, but I felt good about it. I actually got some stuff done, did some projects. So that was a weird low clinic day. You always have those like diehard patients that are coming in no matter what. But the day will go from like 30 patients to 5. Yeah. Right. But you're very important to those 5 people.
Yeah. Yeah. So. And I mean, you can give them more time. Sometimes those days are like fun and enjoyable because you can actually like really slow down and give things more time and, work on your side projects and like maybe leave with all your notes done.
Did you do that?
I did have all my notes done. Yeah. I mean, I saw 8 people on Monday, so I really hope so.
No, I think it was good. Everyone on our team came in, and we were coming from different like areas geographically. So that was cool to see. And again, I don't think they did it to prove a point. I think they did it because they saw everyone else was doing it. And they're like, oh crap, I guess I have to also.
Yeah. And I think like some of this goes back to just what your, expectations are. High expectation people expect that of themselves.
Yes.
And like what you were raised isn't the right word, but like what you have been developed into thinking is appropriate.
Correct. So, for example, one provider that I managed decided she didn't want to come in. She was like, I'm just not going to do that. Yeah. So we canceled. Her patients were canceled. So I messaged her and I was like, hey, I'm going to put in for your PTO. And she was like, no, because it was snowing. And I was like, well, it was snowing, but
like you took the day off.
We were open.
Yeah.
She's like, right, but I didn't feel safe. And I was like, okay, but so that's why you have PTO for certain things. Like if you have diarrhea, you also don't feel safe coming in. So you put in PTO, right? Like, I mean, so it was a
different type of unsafe.
Different type of unsafe, but it was there. This one and another provider, they were like, but my surgeon canceled the day. I was like, right, but that was a choice. If the facility was open and patients had to be rescheduled, like you're going to take a day. Yeah. It was just a very awkward conversation, but I'm not sure where I'm at the end of that, but that was delivered 2 of those this week. It's weird.
Yeah. When I first started working here, my direct supervisor, I was an athletic trainer at the time, and my direct supervisor, we had a weekly journal club meeting because it was like an internship type role. It was not like some situation where we were scheduled to like be seeing patients or be running a clinic or doing something that like absolutely had to be done. It was literally like discussing articles.
Which is great.
It's not a bad thing. I love to do that regularly. We should do that on here. We should have a journal club.
I know. I was actually thinking about that this morning.
Next time.
But I'm not prepared to.
Yeah. We don't have the articles pulled next time. But yeah, it was like a snowing, icing situation. Mm-hmm. Roads were not great. I don't live far, fortunately, or didn't at the time either. And everybody was like, clearly we're not all coming in just for journal club today, right? Like the roads. And yeah, she did not cancel the journal club. And people, I guess, started saying like, hey, what about the roads? Like not coming for this hour thing. And she was like, no, you're expected to be there. And if you're not, that will be one of your days off. And I think we got like 3 for the year. So people lost their minds. I definitely came and showed up, and I think I was one of 2.
One of the only ones,
and so that's just like where my expectations have sat with it.
Different. We've talked about this. So you're not like your peers. So
yes. But there can be good and bad aspects to that because like nobody's giving you an award either. And sometimes that's how it can
nobody
feel.
Well, I was here to recognize you and I definitely walked by and I saw you were here. So I didn't like physically give you a reward. Actually I did.
No, you did physically give me a reward. I got
actually I did.
It's not a physical reward, but it is a virtual reward. Yes. We did get rewarded for it in that sense. But I think high expectation people like ourselves. I mean, I think sometimes when you go into those situations, you're like, I don't know if I'm proving a point to myself. And then you get into it and you're like, what did I do that for? Like, I don't think I feel the fulfillment.
So, I would. Like the higher level, right? So those that make the decision to close a private practice. This is not a hospital thing. It's not like there's someone who owns our building that's like, no, we're not opening the building.
Yeah.
It was on Sunday, but not on Monday. But for myself, like I'm like, I I need to be here for my team,
yeah,
for my patients that actually I didn't have scheduled, but just in case someone came in,
yeah,
someone needed me.
Oh my God.
I was like, okay, I need to come in. Then you have someone like the front desk people, right? That, let's say, don't have 4-wheel drive. Let's say live 40 minutes away. Like if I woke up and I were a front desk person and all my kids are home from school.
Yeah, I get, yeah.
And I think all of them, not all of them, I think a lot of them called out. As soon as they're like, hey, we're open, they were like, I'm taking a day off.
Yeah.
Because there's different level of commitment. Is that fair to say?
Yeah. For sure. Like investment in
and
things.
I'm not sure. Yeah. And I don't want to like clump those people together, but I think I felt a responsibility. I don't think the same feeling, you know, if this is our building and, you know, we don't see patients, we don't make money. Like if this were my building, I'd be like, everyone's going to be at work today.
Yeah.
You know, but I don't think that same level of commitment is there across different.
Yeah. But speaking of, North Carolina is just notorious and bad for losing its mind over these types of things. Yeah, it really was not that bad.
It was not that bad. And then fast forward to Tuesday. So Tuesday, rebound day. We had a late start if you were in clinic. The late start doesn't count if you had surgery at the hospital. So we had a late start. Here wasn't really a late start. Here was like literally a 45-minute delay. So we just did our day.
Yeah.
And it felt great to get back in the routine, back in the swing. Diehard patients, they were like, I'm so happy you're open today. Yeah, that's why I'm here.
We're here.
I was here for you yesterday too.
Yeah. You could have come to see me then.
But no, Tuesday was good. You know, it's ice. A lot of injuries this week. So a lot of the wrist injuries.
I know. And I haven't seen them yet. I know they're coming. And I'm already, so like I spent 40 minutes this morning.
Yeah.
The chatter. I looked at the calendar this morning and I just stared at it for 40 minutes. Like, can I make space and extra days exist that don't exist? Like, how can I, you know, create time
night clinic
that isn't there?
Yeah.
No, clinic. Like OR time.
Oh, yeah. Yeah. Good luck with that.
Amazing.
Okay. All right,
guys,
we're back.
I don't know. It's like a moose situation happening. Anyway. No, moving on from whatever that was.
So
yes.
So when but like when the first part of the week, is so slow. Yeah. Then like I had clinic Wednesday, pretty booked. It was like overbooked. And again, you can't complain because you didn't really do anything Monday. I'm crying, laughing so hard. I'm trying to keep it together. I was really booked on Wednesday. I recently joined faculty for one of our implants that we started using. So I have these peer-to-peer meetings. And these peer-to-peer meetings I don't know.
I gotta get it together. I can't control myself today.
So these peer-to-peer meetings are like these Zoom calls, right? So I have to meet with another PA. They have questions about whatever. So the people that set these up are sales reps, right? So the sales rep said, hey, are you available like 12 o'clock on Wednesday? Sure. So I know it's going to be half an hour. I like get my head right, eat beforehand so I'm not like on the screen, whatever. So I get no heads up. I log into my Zoom and the sales meeting person did not put their camera on and the PA did not put their camera on. And I log in and I'm like, hi. And then they were like, hey. Awkward, silent, and I was like, okay, so
I guess we get started.
My name is so I did my intro, and afterwards I was like, can I just get a little heads up? Like, what's the nature of the call? Like, are they looking for advice or something? But it was so awkward as I'm sitting there explaining myself to a black screen. Yeah, you know what I mean?
Like you can't get like social cues or.
Well, I got a name because it was like across the Zoom screen. But normally it's like, hey, they work in sports medicine. They have questions about post-op recovery, or hey, they haven't got started yet. How did you find the right patients? That type of thing. So anyway, that was weird.
But that's something super cool and new that you're getting to do.
Yeah,
with that. No, that's like a. Not a life stage transition, but like it's like just a new.
Ew, when you said that, I know, but when you said that, it made me feel like diapers, like a life stage, like I'm getting old or something. Like you just said that, I just like pictured myself in diapers, like adult diapers.
Transitioning to that stage in your life.
Where I need to be fed from a tube.
You're not quite there.
I'm not.
Give that time.
There. I'm not quite there.
Give that a little bit more time.
God,
you're going here with it.
I am. All right, we're still here. Sorry, I went off the rails there.
I mean, look, this is the week of going off the rails.
This is dramatic.
So, yeah.
And then Wednesday night, maybe it was Tuesday night, we had our quarterly Injury Express meeting. So I normally do those. So this was like after clinic. Everybody was home because we closed a little bit early one of the days. And I did a whole thing about burnout and like how to avoid burnout. How do you recognize that? What I'm going to do. I also set some expectations for 2026 and set some goals. And the audience, I guess, was front desk, X-ray tech, medical assistant, providers. And then we had a couple managers on the meeting. Anyway, so I was like, hey, we're going to try this. And like, I want the first person, like in the Zoom thing, someone raises their hands. I'm like, oh yeah, go ahead. The floor is yours. And they were like, well, I see a problem with this because of this. Like, why can't the first response be like, that's cool, let's try that?
Yeah.
Never. It's always pushback. It's always met with opposition. Like, well, patients are super unreasonable and I don't think that's a good idea. And I was like, okay, well, you know what? Let's try it. Why don't we try it for like 2 weeks? If it doesn't work, then we'll try something else. And then I mentioned like, and now we're going to try this. Listen to this. You'd probably love this. And if you don't fake it. Okay. So for Injury Express, right? When someone checks in, like at the hospital, I guess, if I have someone, fell and hurt their foot sledding, someone needs a knee injection, and someone fell and think they dislocated their shoulder. Yeah. Green is easy. Like easy visit.
Like a triage situation. Okay.
Yellow's medium. Red, it's going to take a while. Okay. Just take a highlighter and mark the chart. So if you get backed up, you can appropriately communicate to the waiting room, like, I can have 10 patients and it's still going to be a 30-minute wait. I can have 10 patients, it's going to be a 4-hour wait, just so you kind of have an idea. Yeah.
So wait, the provider is marking
medical assistant.
The medical assistant is determining what
so
the
they'll
acuity
know,
is.
And not necessarily to bring them back in a certain order, but if this one's got a dislocated shoulder.
I mean, they should.
They should, right? Whereas if this one wants a quick injection, I know it's going to be a 2-second visit. Yeah. So you can kind of work your day. We do it on the clinic side all the time. Yeah. I'm like, hey, bring back this before my pre-op so I can knock this out, whatever.
Yeah, like I want to be doing this while you're setting up the complicated thing so that I'm not, you set up the complicated thing, I'll do the 30-minute complicated thing, and now the easy thing has been waiting for 45 minutes.
Yeah. So, or if like you're backed up, you have 10 patients and a provider comes over, I don't want you to take my easy ones. I want you to take my medium ones. You know what I'm saying? Yeah. Because it's not going to help me if you're just taking the 2-second visit.
Like I wanted that. Yeah.
I wanted that. That would have been easy. So, anyway, I was like, so we're going to try it. Yes, whatever your name is. And she was like, well, I think patients are going to hate that. I was like, well, patients aren't going to know we're doing that.
Yeah, like how will they know?
But they're going to know, and they get super unruly. Like they're going to yell at us. And I was like, well, we could just try it. Yeah. And we'll see if they yell. Yeah. Or we'll see if this just overall helps us with our wait times.
Yeah. You won't know until you know.
Yeah. So I was like waiting for someone to be like, that's a great idea. Yeah. No. So I did it to myself. I was like, so I did it to myself. I was like, okay, so that is a good idea. Yeah. And moving on. Any questions? Yeah. No. Great.
You're having a meeting with yourself at this point.
I was having a meeting with myself. Yeah. But I did talk about, so we did that. So new ideas, 2026, avoiding burnout. Like I just don't like seeing it. And I don't think anybody talks about it until someone gives a resignation, then you're like, oh, are you burnt out? Yeah. You know what I mean?
It happened too late, or the recognition happened too late.
So I felt good about that, I think.
What are your top 2 tips for burnout? Like what advice did you give and impart?
Okay, hold on.
Okay.
Yeah. I had a fight. I'm going to pull up the slide.
I mean, this could be a whole separate thing on itself. And we've touched on, we have touched on this in the past, avoiding burnout and everything. And I think that kind of dips into like identity, medicine, and
so you'll love this,
work-life balance and all that stuff.
Okay.
I do love talking about.
Okay, so the reality is, in Injury Express, urgent care, orthopedics, whatever, you work in a high volume setting, high acuity, whether you think it is or not, the patient does, nonstop decision making, and very little emotional recovery between patients. So that is burnout. So if you don't stratify the acuteness of the injury, you don't have any time protection for your visits, right? You are then incentivizing, and everybody cares about wait time. So now you're doing careless medicine because you're worried about the bottom line, right?
Stuff, yeah.
Procedure recognition workflow, like give the medical assistant clear roles for procedures. Yeah. If I say, hey, I need a toradol injection in the other room, when I ask for that, you're going to do that because then I move on. But sometimes if it's not there, or the medical assistant's not there, then you're like, okay, now I have to stop my workflow. Let me go back and see if that was done. Like, I don't think we have that. Yeah. Cognitive role reduction. So more streamline preference cards for various things. Like when a pediatric elbow comes in, we splint it this way. Or when a older lady fell and broke her kneecap, we use this brace because I saw it on Monday. So older lady fell, broke her kneecap. Is it a knee immobilizer? Is it a playmaker?
Yeah.
Like why do we still have knee immobilizers? Yeah. Does anybody besides the ER use a knee immobilizer?
I don't think so.
Like, no. Yeah.
I thought that they were phased out, and like the one that I've seen floating around in the back there is just like
for decoration. Yeah, it was like, well, anyway, so the box opened, it was
vintage.
Like crusty. Yeah. like it was like mothballs on it. But anyway, so that type of stuff. And then rotational relief, which we're doing right now. If you just pull the provider out, let's say it's once a quarter and just put their energy somewhere else, which we're doing learning time. Like this is well thought out.
Yeah.
Like I thought it would be
well received and
but anyway, so I think communicating your needs, I think management recognizing it is also really important.
Yeah.
And rewarding positive behavior.
Yeah. And I feel like sometimes and this could be in any aspect of medicine, not that, and we've talked about this before, we feel that we need constant recognition for things. Like, I don't, but a lot of times, especially in those types of roles, the only recognition you're getting is the negative stuff. 90% of your day is you going above and beyond and like trying really hard to do a good job for your patients. But like all you're going to hear about is management calling you up. Why'd you get this 1-star review? Like, what was this about? And you're like, it's that just leads to so much like, it just crushes you. So you're like, why? Yeah.
So my research, right? First come, first serve. Burnout is guaranteed if that's our only rule. Sustainability does not equal fewer patients. Sustainability is due to predictable complexity flow, which I agree with that.
Yeah.
In urgent care, you can't cap numbers. You have to cap the complex patients.
Yeah.
So if you protect your time for those patients, you're not held accountable or sorry, you're held accountable. It's not held against you or whatever. Protect safety and PA endurance. Like it was all good stuff.
Yeah.
I'm not sure if it fell on ears that wanted to hear it.
Yeah, I know.
I hate that.
Yeah. That's not even as much for the providers themselves as it is for everybody else.
It's for everybody else.
Because the provider is ultimately who like struggles the most with the burnout because that's where the emotional toll falls.
Yes.
I think sometimes people like see the busyness
and
everybody is involved in the busyness and don't get me wrong, like everybody plays a very integral role in like making a clinic or an urgent care or an ER flow. Yeah. But like until you're that person in the room with the patient, like with 20 complaints, having to tease out in front of them something that doesn't make sense and figure it out in 30 minutes and come up with a care plan. And you can already tell they're getting irritated with you because they want something that you're not giving them. Like, and you've got 5 other people behind them waiting for the same thing. Like, yes, everybody else around you is busy, but like the emotional toll falls on the provider.
But here's the thing. And again, the cognitive overload is the quiet burnout culprit, right?
Yeah.
So if you're in the room having a discussion with the patient, or let's say someone's crying, and not that affects me, but let's say it's the mom and the girl and everybody's upset and, they end up needing a lot of your attention. You're then supposed to turn it off.
Yes.
And then go to the next one and do that 20 something times a day.
And that's that's tough. And that's why, so like urgent care and ER roles, that is why it works really well to have like the 312 situation and the weekdays in between, because you're not back to back to back. Yeah. And this is why, and we've talked about this, our OR days are so important for us because it is cognitive, but in a different way. Yeah. It, like for me, I need that.
I know.
I need that. And it's not because I shut off my brain those days. It's just working in a different way, not in that like emotional burnout. Yes. That's more of my physical release day, if you will.
Yeah, no, it's like your long distance running when you're lifting. You can't lift every single day. You got to throw a run in there.
Yeah, I feel like clinic is my long distance run days. Like, I don't hate it. I enjoy it. Yeah. But it takes a toll on you physically and emotionally, mentally more than anything. Yes. Long distance running is a mental game. Clinic is a mental game. Yeah. My OR days are my lift days. Those are my lower body lift days. That's my deadlift, my squat. Yeah. That's my bread and butter. I love it. I want to rock and roll through it. Yeah. And you need balance.
You do need balance.
Yeah. So that's my 2 cents on that.
Yeah. So we talked about that. It's a whole topic in and of itself, especially in ortho urgent care. And again, ortho urgent care is just where my head's at with this exact discussion that we had. But as far as surgical orthopedics, the variety, and that's what I love about when I interview PAs, talking to them about why that's so great.
Yeah. Yeah.
You know?
Yeah. No, I think that's, I wasn't at your meeting, but I would like to think that I would have received it well.
You know what my husband said the next day? He's like, how'd your meeting go? Oh, it was good, whatever. He said, did anyone give you feedback the next day? No.
Oh.
I know.
I hate that.
I know. Like, was it well received? Did I do a good job? I have absolutely no idea, but whatever.
Well,
anyway.
Yeah. My Tuesday was OR. We assisted, my surgeon double scrubbed on a big revision case or a big fracture case with one of our other surgeons here. So that was fun. I mean, my role in that situation is a little bit different, but it was a good one and interesting to see. And then had some clinic in the afternoon, just like really scattered, like low volume clinics throughout the week. And then I go to our like northern rural location. I call it the rural location
for walkabout.
Wednesday, this for walkabout day. And I had a pretty busy day that week. Any interesting cases that you saw? I have a couple fun ones that I saw.
So we had a couple really hard shoulders early in the week, and I made the day light because I knew that the cognitive load, like it's not that we can't do more. It's just that the cases that we did were hard, right?
Harder, yeah.
Yeah. So we did
adjust accordingly.
Yeah. We did a lower trap transfer. That was our second one.
Cool.
That one was cool. That one went well. We did a quad tendon repair and reconstruction.
Oh, you told me about
a lady that had tore her quad 7 years ago. Yeah. First of all, ladies don't tear their quads.
Is this the one you told me about last night? And I said that it was sexy.
Yes. Yeah. No, because I know
she was explaining how it went through, and I was like, man.
Yeah, you literally put your drink down. You're like, I am so into this right now.
No, I was. Yeah.
No, that was really cool. Well, anyway, ladies don't tear their quads, right?
Yeah.
This lady was 40, so she tore it in her 30s, and at the time, she was walking up the stairs and fell with weight in her hand and just either fell the right way or hit the knee, whatever. Was evaluated.
Wow.
It was diagnosed, but when they were like, blah, 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 quad tear, blah, 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 surgery, she was like, no.
Yeah, and just kind of.
So now she's got 2 little kids, and when she came in, she's like, I can't run. I'm like, how do you walk? Yeah. So she had this really weird gait. Anyway, so when we got in there, it was nothing. Like the patella and then the quad was like up here. So I'm like, there's no way we're gonna get that back down. So we ended up doing it, but it was that plus the use of a graft. But this lady is gonna struggle. Yeah, I think we had her like 0 to 20 degrees because it was so damn tight. It had to be. Yeah. You know? But she'll do okay. That's like what I love. That's why I love what we do. I mean, that was like the coolest part of the day.
Yeah. Yeah. I love those. I mean, we don't do those obviously, but distal biceps ruptures. Similar. That's one of my, I love doing those.
So I'm very excited to see what she'll look like. She won't be happy till maybe like 2 months.
Yeah.
So anyway, that was really cool.
That's a cool case. Yeah.
What about you?
From a surgical standpoint, I mean, really, we didn't have a ton of volume this week. The doc I work with went to a conference towards the end of the week, so is up learning all the cool things and getting all the good ideas without me in Naples. Not bitter at all. No. It's okay. I'm fine.
I think it's more the Naples part.
Yes.
You know what I mean?
Well, yeah. And I mean, don't get me wrong. I love the learning and conference aspect of it, but this specific facility, hopefully
we'll get there.
Hopefully you get to experience it together. But yeah, from a clinic standpoint, I saw a couple interesting things. I had a jersey finger on Wednesday this week, and I haven't seen one of those in a while, which is surprising. I feel like it's it's not the most uncommon injury, but what's interesting about them is I feel like classically, that was like a urgent, and not to say that it's not, it's like an urgent surgical repair type situation, and a lot of people are not fixing them, and you
even said that like mallet finger. We were talking about mallet finger a couple months ago.
Yeah,
same thing.
Mallet fingers, right? We typically fix if if it's a huge portion of the joint surface, significant displacement, then their joint is not going to function well. We went to a conference though, and that threshold I think got a little bit less for what people can tolerate with it. And there's a lot that goes into it too, like the age of the patient, what their functional demands are. Like I had a kid who played guitar and like isolated DIP flexion and extension is very crucial. So like having that range, not being as stiff is super important.
This was my daughter's friend, and I remember seeing this X-ray, and I'm like, oh my God, you guys should fix that. And
yeah, no,
like,
totally.
This was right at the time. Yeah. I know, and that to me, I'm like, holy crap.
No,
but yeah, well, that's interesting.
Yeah. So the jersey fingers, though, I mean, like if you don't fix it, you're not going to get DIP flexion back.
Yeah.
So had the conversation with the guy, like, do you want to fix it? Do you not want to fix it? Like, here are the results you can expect with it. It's not going to be 100%. And it's going to require a lot of therapy, a lot of rehab on your end, and a lot of time for this. Like, you can choose to go through that.
Yeah.
Or we can leave it be and you can do this instead of this. And I think initially sometimes you have these conversations with people. I don't know if there's like a similar procedure or whatnot that comes up more often for you, but like something where I think logically, like, why go through that for this?
Yeah, for like the final pinch. Yeah.
Yes, yeah.
Yeah, I would not if it were me.
Yeah, for me, again, not a huge issue. I think can live without that, especially for my pinky finger. But I don't want to make that decision for somebody. It's their decision, right? Yeah. But I also like hate the idea of somebody going in and thinking like, oh my gosh, like this is going to be perfect and everything's going to be great and fine and this is going to go easy and fantastic, and then go through it and like wish they hadn't.
Yeah.
You know?
No, we do. I mean, the similar thing in my world is meniscus surgery. Like, someone in their 20s had a meniscus debridement, super easy recovery. I was weight bearing right away, and now I see them in their 40s. And they're like, no, my other one went well. I was like, no, it's not. It's not going to be a debridement for you, and it's going to be a repair. And I'm not sure that's going to be. Like, I don't think it's going to be your end surgery for you. And then it's like, no, I'm okay with that. And then.
What do you do when patients say, what would you do?
You get that, if I were your dad, right? Or if I were your sister.
Yeah, what would you tell me?
So I have that conversation. I actually have a draft in my email because I have had this conversation so many times. Yeah. So massive rotator cuff tear in a very hard worker, like a overhead, whatever. The one guy that we see does like HVAC stuff. So he's lifting, pushing, pulling. Massive rotator cuff tear. He came in because his shoulder hurt a little bit, and that's when you have the conversation of like, it's been torn a really long time. Your deltoid is doing all the work. That's why you can get your arm up here. If we fix this for you, you are a very functional person. It hurts a little bit. I don't know that I can get you back up to where you are.
Yeah.
So your choice is to do nothing, attempt a rotator cuff repair, which you need to be compliant, which guys that have physical jobs never are. That's generalization, but seriously, they're not. Or we skip all that and go to a reverse shoulder.
Yeah.
And we had for one guy, and again, I will line out the scenarios. This is the do nothing scenario. Wait till it gets so bad and then do the reverse. This is the rotator cuff scenario with the percentages of like how successful that'll be. And then here's the reverse shoulder. And one guy I told to do nothing. Yeah. Like nothing. And I said, listen, you go for a second opinion. You'll probably hear reverse shoulder. But I'm telling you right now, that's a massive surgery for a little pain.
Yeah.
So I will have that conversation, which is, and I'll change my answer, depending on what their complaints are. But that's a very hard conversation to have.
Those are. And I mean, like all the time, like say we're looking at an x-ray or something and I'm like, that doesn't look perfect.
Yeah.
And so in their mind, they're like, we need to fix it to make it look perfect. But having somebody understand their expectations for the outcome after that, like, what are we achieving? What's our final goal here is challenging because they see it and they're like, that, but like that, I want it to look different. And I'm like, but what is, like, you're not going to look down and see this x-ray when you look at your hand every day. Right. That's not the part that's going to matter to you.
But I will tell them, like, again, it's their decision. You can't tell them what to do. You will advise them appropriately. I will tell them, I think the best option for you is this, but these other two things remain an option.
Right.
And I will just straight out say, like, when they're like, if I were your dad, what would you do? I say, if you were my dad, I would do nothing. Yeah. In this scenario, I just wouldn't. But if something changes and now you have all these other symptoms, then it's another conversation.
Yeah.
So.
Yeah.
I don't like when they do that.
I know. I don't either, because like
they want
me to decide for them. And I get it. Like, cause these are not easy decisions. I had another similar situation this week, lady with a wrist fracture, distal radius fracture, and it shortened a little bit between her last visit. Now she's pretty ulnar positive. So I'm like, man, we could fix it now and maybe prevent you from having impaction later down the road and having to do a secondary procedure because of that. But like, I don't know, maybe you won't have issues because of it. We can always wait and see, just laying out both options. I'm like,
you're the doc, but you're the doc.
Option A, and this is, and I think ultimately, like, as providers in the back of our mind, we have what we actually want and think is going to be best, but I don't want to impart that and then something go not great, and it's because I made that decision.
Yes.
Right? So they have to ultimately make it for themselves.
Yeah.
Because I want them to be invested in their decision.
Yeah, but you help them, you suggest, but it's an informed decision. You want them to make the best decision for them, and that's not going to be the same thing every time.
I also had a patient this week from the clinic side of things, multiple complaints, like 10 things at once.
Love that.
Yeah. Mm-hmm. And I will say, fortunately, it was at the very end of my day on Friday. So I don't know, this situation would have gone completely different. Would it have been in the middle of like hectic things going on? But I think that was just kind of like a reminder to slow down, and back to what you were saying about like the practicing like fast medicine to get to the bottom line of things.
Yeah.
There's also a big language barrier between me and this patient. And so I know it's like the perfect storm of
that's all the stressors in one room.
All the stressors. The daughter interprets for her. And it's not even like, Spanish, I like know some words, right? This is not a language that I have any wherewithal with. So, there's a language barrier. They initially came in and like, where does it hurt? All of it on both sides. And I'm like, so my initial visit, I probably was in more of a rush situation, ended up getting a nerve test because what she was describing sounded, I was like, I don't know, is it coming from here? Do you have peripheral? Let's get this.
Yeah.
Because the exam is not super clear. Comes back, has findings on the nerve test that are positive, but I make her re-explain, okay, like what is going on with
like
you? And
totally
it doesn't
different.
match what I'm looking at. I'm like, okay, like, yes, this is positive. We aren't going to address it. Like, I don't think us doing surgery for this is going to fix what you're describing. What are the top 2 things that I can fix for you? I can't. Like, they can't decide. She can't decide. She's like, it's all of it. It's here. It's here. It's here.
The top 2 things. My right side and my left side.
And, like the thumb, I'm like, okay, let's x-ray your thumb, see what's going on there, because like this pain you're having in the base of your thumb isn't coming from the findings I saw in the nerve test. She's like, but would my pain in my thumb be causing my pain here? I'm like, also no. So I examine the shoulder too. This is going way out of hand at this point. It's off base. X-rayed the shoulder, rotator cuff chronic tear for sure. I'm like, this is probably actually where most of it is coming from. Like, because it can be like very difficult for people to decipher. Like, shoulder pain can, sometimes cause really weird downstream symptoms. You inject their shoulder and there's not like a great medical reason for it, but like everything else gets better. That's what I'm hoping will happen in this situation.
Is that what you did?
I did. I injected her shoulder. I'm like, you're going to come back in 4 to 6 weeks and we're going to see what else remains and then address it separately. And I had to have that honest discussion. Like, I cannot look at each of these individual things and fix them all at once. And as I had my hand on the door handle to leave, they were like, well, what about her other arm? And I was like,
fade. Yeah.
Yeah. Like, next time, maybe.
Yeah.
Those are challenging.
I get it though,
but
because
I think it left on a good note, and I hope and think that it did the right thing for it. But
I know, but when it's a translator situation and they have all those complaints, if you had the translator there, part of me would be like, let's knock it out right now, because
I know,
next time
I'll be
they're
busier.
not going to come with a translator.
Yeah.
And then you got to wait, and then it's the phone thing, and then
the phone translator.
But it's hard to practice the way you want to practice when you have those variables and all of them in one room. That's really hard.
Yeah. That variable, workers' comp variables. Waiting for authorizations, all these things, the bane of my existence.
Yeah.
on a positive note,
yeah,
I promised I would mention this. So there is going back to Friday, we've circled through the full week now, which was yesterday.
Yeah.
And our party situation, I think there was some matchmaking that happened.
Oh my God, what?
Yes.
Wait,
what? One of the girls here I was talking to a group of people, and we were talking about like, if they've been going on any dates or anything like that. And another girl was like, wait, I have the perfect person for this other girl. Yes.
Yeah, you told me this last night.
Yes. And then come to find out, as the evening progressed, like 3 other people know this person, this guy that they want to set her up with. And it's like, I don't know. We're going to see how this plays out.
Okay.
Yeah. Okay. There could be some matchmaking from that. So that was fun. I enjoyed that.
Second half.
I will have to update everybody as this.
Oh yeah, definitely. So yes. So circling back to Friday. So Thursday night, again, anyone who spent the day with me on Friday has heard this story 500 times. But as the week went on, my dogs got in a huge fight. We had to bring him to the vet, put him under general anesthesia. Between the 2 of them, there was like 15 or 16 lacerations that they had to have stitched. That was like something in the middle of the week that we just like didn't expect whatever. So Thursday night, getting out my outfit for the party. Can't find my other shoe. Like I cannot. It is not located in my house. My entire outfit is dependent
on the shoes.
My entire outfit is dependent on the shoes.
Oh my God.
Yeah. So I immediately blamed my 16-year-old daughter because of course she tried it on and left it where she tried it on. She's like, "What are you talking about?" So tore her room apart, tore my room apart. Can't find the shoe. So I'm like super agitated. Right. Yes. Going into Friday. Didn't have an outfit for the party. I ended up throwing something together, which is fine.
No, it was
a different pair of shoes, which ended up being okay. My feet still hurt, by the way. Yeah. But anyway, so that was Thursday night. Friday morning, the first patient that we see, ACL. She's 46, which, again, back to my sticker system, it's already a yellow, right?
Yeah.
She's gonna struggle. The PA that I work with, he did the pre-op, and I remember him telling me, he's like, "Hey, this one's I don't know about this one." I was like, "Okay." So I get here, she's not blocked. She's still has the doctor in the surgical bay. So like we haven't gotten past that point yet. 7:15, 7:20, 7:30, 7:40.
Oh my God. Okay? Oh my God.
I haven't blocked her yet. So the issue is she says, "I don't want to take any narcotics." The pharmacist told me that I'm allergic to every single narcotic. And we had prescribed her hydrocodone and tramadol. And she told us she wasn't going to take the hydrocodone. Okay. I just want to do Tylenol and anti-inflammatories. And I was like, that's fine.
It's great that that's what you want.
That's fine.
Yeah.
How about we just send something? She was like, "I can't. My pharmacist said I'm allergic." I was like, "Okay, well, your pharmacist is not the one to tell you you're allergic." But anyway, it made on her list tramadol. So I was like, "Let me go talk to her." She said, "Can you write me out hourly a pain plan?" And I did. Yeah. I typed it up because she still had to be blocked. Yeah. I typed up a pain plan for her. She ended up coming back because of the weather potentially this weekend to get vials of Toradol. She's a nurse, to inject herself.
Oh, wow. Okay.
So we gave her that.
Yeah.
When she comes out of surgery, she's literally yelling for Dilaudid. "I need Dilaudid." "Oh, I'm sorry. I thought you were allergic
to it?" Yeah.
Yeah. So guess what she got? Dilaudid. Guess who's not allergic to it? The lady. Yeah. So anyway, so she said, "Can I just get your direct extension so I can talk to you?" I called her Friday at 5 because I needed to do it before the weekend. I called her this morning at 9. I told her I would call her Sunday. She's scheduled for a rescue block Monday, just in case.
Oh my goodness.
But we will have some weather. Yeah. I don't know if we'll be open on Monday. She's like, "Well, on the sheet, you didn't put a contingency plan. What if I can't come in for the block?"
Oh my gosh.
Which is when we had her come back in and get the vials of Toradol.
These things are wild.
So
they
the doctor,
take the capacity.
So the surgeon was like, "Why today? Why right now are you asking me?" Like, that's why we do a preoperative visit. You show up today. And she said to the doc, she goes, "There has to be another med." He's like, there are other meds, but you won't take any of them. Yeah. Because you're allergic. Yeah. So she's like, "I know, but you're the doctor. Isn't there something else?" And he's just like,
I wouldn't be gatekeeping something.
He's like, "Are we done?
Yeah.
Are we done here? Like, are we going to do this?" Anyway. So that was Friday morning. Isn't that crazy?
Oh my gosh. Those are so frustrating because you only have a finite amount of options for people,
but
right?
Again,
and
setting expectations.
Yeah.
But everything about this patient. So we email them a post-operative video of our doc, telling them what they did. She won't give us her email. She goes, "I prefer a text." And I was like, "Can you just give us your email?" Yeah. She's like, "Okay, but I'd rather you text it to me." Yeah. I'm Like those people that come in and they must control every little thing. Like this is not, it's not going to work for you.
Oh yeah. Yeah. And you just know that like everything's not gonna.
So we started that surgery at like 8:30. We started late. That was our first.
That's crazy.
I know.
8:30 is like an hour late.
It was an hour late, but I taught her for Friday and she sounded good. And today she sounded good too. So
yeah, I think also in those situations, right? Like, I mean, it sounds like it was a little bit delayed in the sense that she was still having these questions and issues in the bay right before, but like you put in a ton of effort on the front end,
to avoid
hopefully that will,
scenario.
You won't have to on the back end deal with as much. Well, cool.
Anyway, good. And then, so then fast forward through the day, got another outfit, went to the party, and here we are.
It was great. It was fantastic. It was supposed to be snowing excessively right now,
it's
and
not.
I see none.
Yeah, no, it's supposed to start at noon, so maybe soon.
Maybe we will. All right, well, until next time, I don't know. What are we going to talk about? Are we going to have a journal club next week?
Yeah, I think we should do something clinical. I'm very excited to talk about that. Yeah. Let's just find. I got a lot of stuff that we can talk about.
Yeah, we have a lot of things to discuss. I'll be coming off 48 hours in Vegas.
Yes. Oh my gosh, I forgot about that.
Yeah. So we can talk about that.
We can talk about that.
Yeah.
Yeah.
All right.
Okay. Have a good week, guys.